Getting a coronary artery disease diagnosis can be overwhelming and stressful. However, understanding coronary artery disease and heart attacks is vital to maintaining your overall heart health. So, how does coronary artery disease relate to heart attacks? Coronary artery disease, or CAD, is a common heart condition where the major blood vessels that supply the heart or coronary arteries struggle to send enough blood, oxygen, and nutrients to the heart muscle. Cholesterol deposits that form into plaque in the arteries creates inflammation, which is typically the cause of CAD. If you have CAD, you may be at risk for having a heart attack. A heart attack, also known as a myocardial infarction, or MI, happens when a part of the heart muscle doesn't get enough blood. A heart attack, or MI, is also referred to as a cardiac event. The more time that goes by without treatment to restore the flow of blood, the higher risk there is of increased damage to the heart muscle. So, what causes heart attacks? Most heart attacks are caused by coronary artery disease, which is also called atherosclerosis. Atherosclerosis occurs when a plaque gradually builds up in the arteries that carry blood to the heart muscle. This buildup of fatty deposits causes the arteries to narrow and stiffen over time. As the arteries narrow, it becomes more difficult for oxygenated blood to flow to the heart muscle, which can sometimes cause pain and discomfort known as angina. If a piece of plaque ruptures, a blood clot can form and block the artery even more. Once the artery is completely blocked, blood flow to the heart will stop and a heart attack will occur. What are the symptoms of a heart attack? The symptoms you feel during a heart attack are caused by your heart muscle being starved of oxygen, preventing it from effectively delivering oxygen-rich blood to other parts of your body. However, as plaque builds up over time, you may not have symptoms until there is a significant blockage. Some heart attacks are sudden, but others start slowly with minimal pain. Common heart attack symptoms include chest pain that may feel like pressure, tightness, pain, squeezing or aching, pain or discomfort that spreads to the shoulder, arm, back, neck, jaw, teeth, or sometimes the upper belly, cold sweat, fatigue, heartburn or indigestion, lightheadedness or sudden dizziness, nausea, and shortness of breath. What are some different terms related to heart attacks? Acute coronary syndrome, or ACS, is a broad term for conditions where the blood supplied to the heart muscle is decreased. This may include STEMIs and NSTEMIs. A STEMI, or an ST elevation myocardial infarction, is caused by a complete blockage of a coronary artery. This is one type of heart attack that can be diagnosed by looking at an electrocardiogram or EKG. An NSTEMI, or a non-ST elevation myocardial infarction, occurs when an artery is partially blocked and there is a reduced blood flow. This is not visible on an EKG but can be diagnosed by having blood work done. Coronary thrombosis occurs when a blood clot forms in one of the arteries that supply blood to the heart. This may also be termed a coronary occlusion and can cause a heart attack. These are all considered cardiac events. Always call 911 if you are experiencing new or worsening symptoms. Your care manager is always here to help you navigate these situations. Please communicate any questions or concerns about CAD to them. We value your health and safety, and we are here to help. Thank you for watching the Coronary Artery Disease and Heart Attacks video. You can find more educational videos on heart attacks or coronary artery disease and other topics in the resource section of the app.